or you have to improve something else, you can go through with this analytical QC process. Then focuses on numerical results validity. So just issuing a report, you can validate your result, right? So once you receive the results, you can go through again with the results and think that this is validated with the patient's clinical history and on that day QC performance. You can think, and uh, in concept of the process, you can monitor the workflow and procedures, ensures proper documentation, assesses staff competency, focuses on operational consistency. So in this process concept, you have to monitor each and every step related with your quality assurance. So it's starting from generating request until the issuing reports. No, you have to ensure the proper documentation, and you have to ensure the competency of your staff, whether the staff is competent enough to do this, are they are receiving any continuous knowledge updates. Likewise, you have to think that uh, process wise quality control things. Then this quality assurance term, so it describes all the steps taken both in and outside the laboratory. So as a broad term, quality assurance means not only the concern of laboratory people. It starts from the Ministry of Health and director in the relevant institution. So each and every steps from the management hierarchy, what are the action they take place, what are the things they implement
Excuse me.
based on the generating reliable results. So
Excuse me.
broadly it is termed as quality assurance, but
Can you
sorry,
hear me? Excuse me.
Excuse me.
Your slides are not moving, ma'am.
Same thing I have to say.
is it okay now?
What is the slide? Which slide you are going to speak? Is it 9?
I couldn't get you. Could you please?
Which slide
We
you are
didn't see
moving?
other slides, ma'am.
Can you please say
Madam,
the
which
slide
slide you
number?
are reading?
Now I am in the quality assurance slides. Is it visible to you?
Yes, yes.
Yes.
You can see.
8th one. Yes, yes. Now okay.
Is it okay now?
Is it okay?
Yes.
Okay.
Okay, thank you for the
Someone
information.
writing on the screen. Please stop that.
Yes. Right, shall I continue? And that this quality assurance in the laboratory involves mainly internal quality control and external quality control. But out of these two things, each and every person in healthcare sector should involve in this quality assurance process. So let's move on to the internal quality control thing. So it's this broad term describes each and every steps taken by all healthcare professionals in their day-to-day activities, even with the porter or the sample taking person, cleaning staff member, doctor, nurse, MLTs, every person in your institution, what they are doing in their day-to-day life activities. So we need to perform internal QCs every day, and not only the doing the certain samples, you have to think about the total laboratory process, which includes pre-analytical, analytical, and post-analytical phases. So IQC is a set of procedures undertaken by the staff of a laboratory to ensure quality from specimen collection through test performance to analytical results, and the procedure is planned and followed up by the staff themselves. So it includes each and every step in your laboratory. So Basically, internal QC measures the precision. So precision means closeness of the true value. So let's move on to this slide. So here I recorded certain points. So the things that you can perform in your laboratory as a internal QCs. So daily performance of QC sample and maintain QC chart is a heart or the one important thing related with the QCs. But the other things like daily recording of temperature in your refrigerator, incubator like thing, calibration of pipettes and balance you are using in your laboratory, following acceptable and authorized standard operation procedures, internal audits by the quality officer, proper storage of reagents, QC materials and specimens, documentation of everything, cleaning and waste management. So those things also included in this internal quality control. Not only the performing QC samples and just plotting the QC value on the LJ chart. So that's why it's called that internal QC is the backbone of daily laboratory activity. So if you need to perform these QCs, first of all, you need to running the control materials with known values alongside the patient sample. So when you are doing these QC materials, you have to perform with along with the other patient samples. So you need to compare the measured values against established acceptable range. So that means before implementing a QC program to your any laboratory method, you have to establish certain results or the ranges to interpret it daily. Then documenting all QC results with date, time and operator is very much important, because when if you are recording your QC data correctly, you can go back and check what will happen on any day. Then taking immediate corrective actions before issuing the result. So if you observe any QC rules violation or something, you have to take the immediate correction. You can't postpone the things next day. Then and there you have to complete the things and go. And regular review of accumulated QC data also important, because nowadays I think that once you perform the QC and just you enter in your documentary system, that is not the end of the QC recording. So there should be a person to regular review this accumulated data, either weekly or monthly or annually, what kind of things happens inside your laboratory. So it will helpful to your improve your performance, improve your laboratory quality. So before moving to the QC charts and rules, I need to introduce certain important terminologies like accuracy, which is agreement between the measured value and true value. So always accuracy will explain by the EQA system, closeness to the true value. So the precision is the closeness of agreement among the set of results. So that means if you perform your QC data, QC sample every day, you can check the precision. So today value, tomorrow value, and day after tomorrow likewise, you can check agreement between these results with your true value. And the other important two terms are bias and inaccuracy. So bias means difference between a measured value and the true value, with either it can be positive direction, positive bias or negative bias. Sometimes it will deviate highly, sometimes it's lower than the accurate value. The inaccuracy, percentage of the difference between the measured value and the true value over the true value. So that means how much of your deviation as a percentage. So you have to reduce from measured value, true value, and divided by true value by multiplying 100. So percentage of inaccuracy, that means how much you deviate from your results. Then the other two terms are sensitivity and specificity. So these two terms are very much important when you are selecting certain procedures. So as an example, if you are going to start a new procedure with existing without doing the existing method, you have to think about the new procedure, sensitivity and the specificity. So sensitivity means ability of catching up the true positives. So when we are doing the test among patients, there can be patients with disease, some people are without disease. So if you are applying a new technique, you should be able to catch all the positives without missing. So that means the sensitivity to detect the true positives. Specificity means to detect the true negatives. So if you are applying a method to catch up the positive patients, as well as that same method should be able to remove the negatives, those who are doesn't have the disease. So that means to ensure the normal people. So when we are selecting a procedure or the method or new adapt new things to the laboratory, you should consider about this sensitivity and specificity. Then the other terms are highly statistical words, normal distribution of data and statistics. So actually statistics is a branch of maths uh, which will help to which will help to collect, analyze and summarize set of information. So once you have completed your QC results, there's a number of results only. As an example, if you are performing your QC for glucose assay, you will receive 100, 101, 102, likewise only the numerical values. But if you apply certain statistical calculation, you can interpret it nicely. And more information you can express rather interpreting a single values. So if your data set, if you obtain a data set and if it is in a normal distribution like Gaussian curve, 68% of values rely within the 1SD, which is highlighted in green color, and 95% will fall in between yellow and green, as shown in the diagram. So you can use this range as a warning limit, right? So if your sample, when you are performing your QC daily, if you exceed this 2SD value, it's a warning, right? So according to the Gaussian distribution, your 99.7% of data sets rely on 3SD. It should be a action limit. So most of the time, earlier earlier in before the Westgard rules, they take this 2SD line and 3SD line, right? So I will explain later how you are plotting these LJ charts. Then other thing is central tendencies. So this is also maths termination. So this, it's a descriptive summary of data set. So once you obtain the QC data, you have to calculate to express that data in a explainable way. So you need mean, median, mode, the calculation, and the important thing is the standard deviation. So to calculate the standard deviation, you need to know about this mean value. So it's a summative of all data set divided by number of score. So this is the equation for standard deviation calculation, but I think this uh, calculation equations are not important these days, because if you enter your data set into the computer, there are many formulas to calculate this standard deviation. So this is the oldest method of calculation, the standard deviation. I just placed here to show you, so you can go through later how we can calculate manually the standard deviation. So once you calculate the standard deviation, there's another important parameter, coefficient of variation, is standard deviation divided by mean and 100. So if you obtain a very much low coefficient of variation, that means your precision is very much good. That means data set is precise. That means each and every value in your data set is close together. So, in this coefficient of variation, there are two types: optimum condition variance and routine condition variance. So, optimum condition variance is you have to perform the data set or the QC in an optimum condition from the same sample, same day, under ideal condition. So, ideal condition means it should perform by the same person by using same procedure, same apparatus, same reagents, same instrument, and the same calculation procedure. That means you are treating each and every time of your testing same manner. There is no deviation. So if you obtain less than 3% values for optimum condition variation, that is indicating your good performance. So your test procedure OCV is less than 3%, it indicate your precision is good. In the other way, routine condition variance, in this may routine condition variance, you have to perform the your QC values same material, but 20 different working condition, 20 different days in routine working conditions. So that means if you start today, you have to perform the QC in 20 days, continuously 20 days. If you place your sample in your rack at the first position, next day you have to change the position. You can't keep always your QC material as the first sample. So routine means you have to change your position even. And after calculating the CV, if you receive less than 6%, your routine condition variation is good. So normally when we are introducing a method, first we have to calculate this CV, OCV and the RCV to check up to which amount you can rely on this method. Uh, then there's another important two terms before going to the QC rules: systematic errors and random errors. So the systematic errors means uh, there's an error arise within your laboratory results in the same magnitude, in the same direction. So it can be either positive side or the negative side. Sometimes if you are in if you take your cholesterols or the potassium values, it will increase in the same manner, each and every sample same magnitude, uh, getting changed. So all results may be higher all over than the true value. So these are the reasons, some few causes for systematic errors: wrong procedures, use of unsatisfactory reagent. So if you are using a not good reagent for each and every test, that whole test results will getting the same magnitude error. Then incorrect standards, incorrect or infrequent calibration. So you are not calibrating your instruments properly, it will affect the results in the same manner. Use of expired QC, treat at the incorrect wavelength. Sometimes you are instrument, then nowadays almost all the laboratories are with automated analyzer. So wavelength is not a big issue. So but you have to check whether these things are incorrect or. Then think about the random errors. It's an unpredictable error. You can't even imagine what will happen once this is appear. It can be either positive side or negative side in different magnitude. So today it will be double the result, the next day it will be reduced. Likewise you can't predict the magnitude and the direction always. So these are the causes for some random errors. Faulty technique: sometimes the same person pipetting can be changed. So inadequate mixing of sample and dirty glassware and the too heavy or too low workload. Sometimes you are, because of the too workload, uh, you are hurried to do the process. Sometimes you are with very low workload, you are not interested to do that. So at that time some random errors can happen. So unstable spectrophotometers, colorimeters, now unstable auto analyzers. So dirty cuvettes, you are not using the clean cuvettes. Sometimes when you are washing, if you are not monitoring your waste management or the washing procedures, some people are there, they are hurried to clean and go. So you have to observe, you have to ask them to clean properly. So incomplete removal of interfering substances. So when you are introduce your sample to the analyzer, example like in creatinine, you know that hemolysis is interfering factor. So before adding the samples to the analyzer, you have to observe uh, the amount of hemolysis. So I think then now there's a the LIS system called in the auto analyzers, there's a system to identify the lipemic, hemolytic, and the bilirubin levels of the serum sample. So then automatically machine can decide whether going to analyze or not. So with these terminologies, let's move on to the QC charts. Actually, QC chart is a simple visual tool. Earlier, it was displayed in a laboratory area, but nowadays it's in your computers because almost all the auto analyzers are coupled with uh, computer things. So you can easily plot and observe the LJ charts through your computers. In a LJ chart, it's a simply XY chart. X-axis, you can have the days or the frequency, number 1, 2, 3, or the dates. And the Y-axis, it's a concentration. And in this y-axis line, you can identify the mean value. Once you obtain your data set, you can calculate the mean, and the central line is the mean. And you can, after calculating the SDs, you can add plus 1 SD, plus 2 SD, plus 3 SD. So that means you have to add mean plus 1 SD value, mean plus 2 SD values. Likewise, you can mark 1 SD, 2 SD, and the same way minus 1 SD, minus 2 SD, and minus 3 SD. But if you, after constructing these LJ charts, you have to apply your QC, the same QC material in daily basis. But for, still, once you analyze the QC material and plot the values in your chart, there should be a way to catch up the error. So that's why we are introducing Westgard multi-rule charts. So most of the time in laboratories, uh, before applying the Westgard multi-rule charts, they need to calculate these high normal or pathological samples with 20 different days. That means you need 20 number of data set and calculate your mean deviation. So based on that, you can construct your LJ chart and introduce these two or one. Sometimes you are using one QC. Some laboratories are there, they are using two QCs, because based on the analyte, or that means whether it is a glucose or calcium or whatever the thing, sometimes hormone assays, you need to apply one QCs or two QCs or three QCs. So record each and every control value in your LJ chart. And there are 6 important Westgard rules to remember. Uh, if you search the Westgard rule, you can observe a lot of rules, but the 6 rules are there. These are the important 6 rules which are applying in our country and most of in our biochemistry laboratories. So the first one is 1 2s result rule. So if one data exceeding the control value uh, more than the 2SD line, it's a warning rule. So that means uh, it alert you something is behind this value, but still you can release your results. So if you observe 1 2s rule violation, still you can release the results, but you should on alert the next day and after day. Likewise, it's a warning rule. Then the second one, 1 3s rule. So that means the control rule, when the control limits are exceeding the 1 3SD plus or minus, either it can be plus side or minus side, your QC value is more than 3SD. Definitely this is a rejected rule. So, and it's related to random error, right? So immediately you have to stop the run. Please don't issue the patient's results and find out the root cause and try to correct the error. So the first rule which is rejected rule is 1 3s rule. Then 2 2s rules, that means 2 consecutive days your control limit is more than 2SD. So in this example, day 2 and 3, both days, that control value is in plus side and it is beyond 2SD. So it's sensitive for systematic error and it's also a rejection rule. If you observe a 2-2s rule, definitely you have to reject the run. That means you can't release your patient's results. So most of the time this kind of errors can be happen due to calibration drifts, reagent deterioration. Sometimes your reagents are not in correct temperatures, expired. Sometimes reagent bottles are not enough to aspirate the reagents, likewise, and temperature fluctuations of the instrument as well as the refrigerator, then instrument component failure. So those reasons are the common reasons for this 2-2s result. So anyway, you have to go through your system maintenance and again do the calibration, and if you need to replace your reagents, you have to change it and correct the error. So 2-2s is a rejection, which is systematic error. And the next one is R4S rule. So that means uh, if you are applying two QC value, two QCs, that means normal and pathologically high or low one measurement exceed the plus 2SD and the other one exceed the minus 2SD. So this rule you can basically apply with the two quality control serums. So definitely this is a rejection rule and sensitive for random errors. So and sometimes it can be uh, so sorry, this is very helpful in multi-level controls. That means if when you are applying 2 or 3, so most of the time 2 controls, this R4S rule is very much important. But don't think, panic that if you are placing a one control sample, if you place today, if it is plus 2SD, and the next day, if it is negative 2SD, that's also a R4S rule violation. In this diagram, it's showing in 2 days, day 5 and day 6. But if you are using two control serums, you can observe this R4S within single day. That is the kind of advantage if you are using two types of QCs. Then 4-1s rules. So that means this is a definitely rejection rule and it indicates the systematic error. That means consecutive 4 days. Uh, day 7, 8, 9, and 10, which are highlighted in this image. So 4 consecutive days, your uh, results is more than 1 SD, but it's in a systematic way. That means in this image, it's in the negative side, but uh, each and every day you can release your results because you are results in a proper way, but it will indicate after fourth day, it will indicate there's a something in systematic way. So common causes are early reagent deterioration. Sometimes before starting the major errors, gradually that reagents deterioration, gradual temperature changes, then light sensitivity parts in your instruments, and instruments aging. These things you can catch up with this 4-1s rule. And the other one is 10x rule. 10 consecutive days your measurements falling on one side of the mean. So that means it can be either plus sides or negative side, all 10 values, but in one part, this is a rejection rule and sensitive to systematic error. But nowadays it's described that rather waiting for 10 days, uh, there's a rule, 8x rule. You can take the decision at the 8th day. But uh, the important QC things, you can have the rules 1 2s, 1 3s, 2 2s, R4s, 4 1s, and 10x, 10x or either 8x. So by applying these rules, Westgard rules, this is the way of going whether this your result is acceptable or not. So if your result is data, the control sample is 1 2s, and if it is no not the beyond the 1 2s limit, your QC is in control. Likewise, by going through these arrows, you can find out whether your QC result is in control or out of control. So after getting this QC data, there are essential steps to follow up. So each and every date and time of each QC measurement you have to document. Then operator identification. Who is the person responsible for that day's QC result? And control lot numbers and expiry dates. What is the lot number and what is the expiry date of your used QC? Then instrument identifiers, original measured values without changing, without altering what is the original QC value. Then are there any rule violations or anything, any special flags like? So you have to mention on this documentation. And the special thing is, what is the corrective action you take once you observe the error or once you observe the problem? What is the corrective action you take? Then, when you are choosing the QC materials, you should concern about the matrix of the QC. So, based on, if you are analyzing serum sample, your control should be a serum based. If you are use urine analysis or the urine QCs, it should be urine based. You can't use the different matrix for sample assays. So that means you can't use the plasma basis of serum controls. So you have to always use serum based. And stability. So this QC should long shelf life, resistant to changes for a long period of time. Then commutability, that QC sample should act like the same as say patient sample. So even if it's a prepared one, it should act like a patient sample, that cause commutability. Then concentration ranges. So there should be available of low values, normal values, and pathologically high values. So then you can expand your decision limits, or the it will help to issue the reports easily if you are using 3 levels of QCs. When you are receiving QCs on your laboratories, you should concern about the batch number of QC, lot numbers, expiry date, biohazards things, and whether it is a lyophilized or liquid sample, the storage condition, whether you can store the QC materials appropriately, and maintain of cold chain. That is very much important. Once you receive the QC sample, whether the manufacturer sending cold chain procedure is still there. If it is exposed to direct heat, likewise you have to check the maintaining of cold chain, otherwise your sample will deteriorate. So next 2 slides, I will explain how to reconstitute these lyophilized materials. So after checking all the batch numbers, lot numbers, expiry dates, and everything, you have to open your QC vial very carefully. But keep in mind, don't touch the inside lid with your bench, right? Then it will contaminate and some part of the QC materials on your lids. So reconstitute with the appropriate amount of distilled water or the any special diluent supplied with calibrated volumetric glass pipette or calibrated automated pipettes. So when you are reconstituting your QC materials, ensure the using of calibrated pipette always. And the same way, the same time, the distilled water you are using should be at room temperature. And once you add the appropriate volume, carefully recap the rubber stopper and leave the 30 minutes away from sunlight, because uh, if you are analyzing bilirubin in your sample, it is a photosensitive thing, and if you place it on a exposed light, it will deteriorate. So try to keep away from direct light. Then gently mix your sample without shaking, and roller mixture is the ideal apparatus for reconstituting. And you have to aliquot the reconstitute QC material into always into a new plastic appendix, because appendix it's very difficult to clean. So try to use new appendix as you can for storing this storing this QC material for daily purpose, because normally in a QC material bottle it's about 5 ml, so you have to aliquot this 5 ml into 500 microliters samples. Then you need to take only one sample at a day, so you don't want to take whole bottle out and again put into the refrigerator. So you can just pick a one append off per day, right? So the other important thing is you have to label whether this is a pathologically normal, high or low QC, especially with the preparation date, right? So once you prepare these QC materials, you can analyze it on the daily basis, take it out from the refrigerator and carefully thaw the sample up to the room temperature, right? And then gently mix the sample, because during the refrigeration it can cause crystallization, so you need to ensure the homogenization of sample. And after maintenance procedure is complete, that means your startup procedure is complete, you can perform the QC value. After the calibration procedure, you can run the QC samples and you can obtain the QC value and plot on the LJ chart. Then you can go through with the Westgard rules to check whether there is a violation or not. So that is how you have to analyze your QC in daily basis. And there's a problem, most of our people are misidentify this QC and calibrators. So QC is something different than the calibrators. Always calibrators are related with the instrument signal and the concentration. As example, if you are using a spectrophotometer to measure a blood glucose level, the signal that issuing after analysis is related with the concentration of the blood glucose. So, calibrator or the calibration material. Sometimes calibrator is a material, sometimes calibrator is a chemical. So it's a material or a device of known or assigned quantitative or qualitative characteristics used to detect calibration function in the measurement of a procedure or instrument. So it can be either liquid calibrators or instruments. Sometimes the calibrator is an instrument. And it has a known concentration of the substance. That means if you are using a calibrator of glucose, that glucose level of that calibrator is known, and you can adjust your instrument signal, whether it is a light signal or something else. You can standardize this signal based on the concentration. So sometimes you can use single point calibration in the red color and multi-point calibration. You can apply 2 or 3 calibrators for the calibration purpose. Uh, so calibration graphs can be linear or curved, and this is not a true standard, right? So and the other thing is calibrate is not a QC. You can't use calibrators as quality control materials, right? So observe calibrator values within the limit assured that analytical method is working properly. If you obtain after calibration, if you obtain the assigned values, that means your instrument giving the correct signal for the correct concentration, right? Then the other part is external quality assurance system. I think the internal QC, I need to mention only the what is IQC, and how to prepare the LJ charts and related mathematical calculation and things, and how to apply Westgard basis. Uh, I requested to do those things in internal QC. When we are discussing the internal QCs, it's important to pre-analytical, analytical, and post-analytical phases also. Uh, the other main part of my presentation is EQA, or the External Quality Assurance System. Actually, EQA, it's a periodic assessment. It can be either once a year or twice a year. Assessment of your laboratory performance by a external body, and the align with the EQA system is very much important because alerted you if you are in a, not good quality control things. So, why we need EQA? It allows the comparison of performance and results among different test sites. So, if you are participating in EQA program, it provides early warning for systematic problems. And EQAs ensure the accuracy of your test results. If you provide a good performance on your EQA materials, that means your day-to-day routine uh, workforce is accurate. It provides objective evidence of testing quality, indicates areas that need improvement. So once you provide the EQA results, and your feedback indicates what areas you need to improve. If it's a staff training or infrastructure changes, you can change the required things. So this is the process. Once you register with the EQA organization, they will send you the samples, and in your laboratory you have to analyze the sample, and you need to send back your results. When you are sending back the results, it is very much important to double check your results before sending them. Then they evaluate your results with your peer group. That means the same procedure, same instrument, same reagent. Uh, Laboratory people are together, and they evaluate you and send you the report. Then, based on their performance report, you can take the corrective action. So, these are two types of indicators. One standard request report, and the other one is our MRI National EQA report image. So this type of report you will save as a EQA report. Mm, so EQA samples, that ideal EQA sample should be stable during transportation. There won't be any changes during storage or transportation, and it should be homogeneous. And each and every concentration of each and every analyte in the sample should be mentioned. So there's a list of analytes along with the EQA sample, and most of the time the matrix of the EQA sample should be similar as the patient samples, and it should available in sufficient amount. And the other thing is it should be a commutable sample, as I mentioned earlier. And there are three ways of doing EQA. So normally almost all of our laboratories are participating in this proficiency testing, and the other one is on-site evaluation and rechecking. So in proficiency testing, the samples sent by the external bodies, and we have to analyze in our laboratory and send back the results. Then based on the results, you can they can give you recommendation for your performance. Then the on-site evaluation means periodic site visits. So it can be done by a external body. You can prepare your own file called laboratory manager or some quality officer. He or she can visit, assess, and
Excuse me,
supervise
HML
your
के हेरत please. HML के हेरत please mute your mouth.
right. So the this on-site evaluation, either it can be done by a external body, or you can arrange your own audits as an on-site evaluation. So that means then and there, while you are working, then and there they can come and evaluate you whether you are doing the correct procedures. The other one is retesting. You can select randomly your routine samples, and you can check with the reference laboratory for your validation. Actually, most of our laboratories are participating with this proficiency testing. Then the other important thing is, if you receive a EQA report, right? So normally in a EQA report, they mention the analyte name, what is the method. That means if you are using a glucose oxidase peroxidase method or hexokinase method, you are using a creatinine Jaffe method or enzyme method. Likewise, based on the assay principle, based on the instruments, and based of the reagents that you are using, they categorize you. And number of participants, that means in your cluster how many other participants are there, and uh, that group mean, that group standard deviation are mentioned. And there is another important three parameters: SDI, standard deviation index, percentage bias, and accuracy index. So these three things are very much important when you are reading EQA reports. SDI means the deviation from the expected results. That means if you expect results as M, but you are receiving the sample result as X. So X minus M divided by S. S means the SD of all participants group. So it's not necessary to remember this calculation, but the only thing is SDI less than 2 is acceptable. If they mention your SDI is more than 2, that is your result is unacceptable. So when you are reading this QA report, SDI value is very much important. And the other two things are percentage bias and the accuracy index. Percentage bias, if it is less than 5, that means your performance is very good. But less than 10% also acceptable, but you need to change some things. And accuracy index, uh, it allows, sorry, if it is your accuracy index is less than 100, that means your performance is very good. But up to 200 they will allow, but 100 to 200 means you have to go through back with your procedure and need some enhancement. So if you if you receive an unacceptable EQA result, that means that they sending you a report that you are not in a proper way, that your EQA results are fake. So the first thing you have to go through and check whether there any clerical errors, because if you place a single decimal in a wrong way, it will end up with your wrong EQA result. So as an example, if you are analyzing your samples of glucose in millimoles per liter, but if you are entering as a milligram per deciliter thing, you totally get a wrong result. And methodological problems, the same way you have to select the proper method. If you are registered with the EQA program with creatinine hexokinase, but actually you are doing the Jaffe reaction, so those things are not compatible. And equipment problems, then technical problems by personal errors. So as we are humans, we can add lot of errors when we are doing the samples. So a problem with the EQA material. So it's, you can think, when you are receiving the samples, you have to carefully go through with the sample whether this is appropriate sample, received in a good condition or not. The first thing, once you receive the EQA sample, you have to note down all the things upon receiving. So that is the end of EQA things. That means the last part of my presentation. What do you mean by good laboratory practice? Uh, so actually, this good laboratory practice, earlier we discussed related with the total laboratory workflow. I mean that pre-analytical, analytical, and post-analytical. But with this new term, good laboratory practice, if you are if you can adapt it with this good laboratory practice, it's ensure the quality and validity of your test results, and it improves the laboratory safety and efficiency. So if you are practicing in a proper way, it will improve the laboratory safety. Each and every person in your laboratory is safe, the environment is safe, and it will enhance your efficiency. Then it will facilitate the accreditation and regulatory compliance. If you are trying to go for the accreditation, good laboratory practice is a key thing. And then support accurate diagnosis and patient care. Ultimately, we are here to generate a result for a patient. So if you are in a good laboratory practice process, it will support the accurate diagnosis and patient care. So in under the chemical pathology, uh, the good laboratory practice apply in all stages of laboratory workflow. As I mentioned earlier, it includes pre-analytical, analytical, and post-analytical phase. So it's it can apply for the routine clinical diagnostic labs as well as the research labs. So the key components of GLP are, the important thing is personal qualifications and training. So you need to appoint qualified persons for the laboratory practice, and not only that, you have to train them periodically. And the other thing is, always follow the standard operation procedures. Don't violate the SOPs. Always try to stick with these SOPs. And equipment calibration and maintenance. So you have to maintain another person or the another registry for the proper calibration and maintenance. Each and every problem and what is the solution you take, those things should be recorded and retrieved. Then quality control and quality assurance systems, documentation and record keeping. Not only that, each and every steps in your laboratory should follow a standard protocols or the things, including safety. Though the safety means biohazard safety, chemical safety, fire, and radiation. Likewise, safety practice should be there in each and every component. So let's quickly look at the one by one. Personnel and training. Competent, well-trained staff are essential for good laboratory practice compliance. So regular training on laboratory safety, analytical techniques, equipment usage, SOPs, QCs, and QA. So those things are included, should included in personnel and training. SOPs, try to adhere with SOPs, and try to update your SOPs with the current situation. That means don't adhere with the all very old SOPs. If you need to change it with authorized bodies, you have to change your SOPs into the modern techniques. And equipment maintenance and calibration, you need to follow the regular calibrations, maintenance logs, and malfunctioning equipment should be repaired before use, or you have to discard them. Then sample handling and processing, you have to use the correct labeling system, proper storage. So most of the laboratories are now using this barcode system. Actually, it's a very good adaptation. So the other thing is, if you are receiving a sample with insufficient, incorrect labeling, missing samples, there should be a separate register for that note downing. Then you can observe which ward frequently sending this type of samples likewise. Then quality control system, as we discussed, internal QCs and external QCs, and thirdly, it's termed as quality assurance. So monitoring the overall laboratory process, and uh, audits and corrective actions are very much important. So before auditing by the other person, we can arrange within our laboratory self audits once in a month or weekly to audit our reactions. So then especially regarding benchmarking performance indicators like turnaround time, error rate. So then we can minimize our errors and enhance our quality assurance system. The other two things, data management and documentation. So accurate recording is very much important. I think this kind of laboratory cabinets are not there now, because almost all the things are computerized, so you can easy to document everything, and always try to engage with laboratory information system. And the other important part is, you should concern about where does my waste go. That means you have to use PPs, personal protective equipments, correctly. You have to dispose biological and chemical waste properly. Then the other thing, after disposing in your laboratory, you should concern where it is going, and you should concern on these things also. So these are some accreditation bodies in Sri Lanka, Ministry of Health and MRI guidelines, and international standard like ISO 15189, WHO standard, CLSI, and College of American Pathology standards. So accreditation ensures compliance and continuous improvement. If you are aligned with accreditation, then it will automatically
I
go
get
with
100.
continuous improvement. So these are the challenges for good laboratory practice. The first thing is resource limitations in our country, then staff turnover, resistant to change. So it's a very big issue. If we are not try to change, and if we always refuse to change, there won't be any improvement. And inadequate training, so try to learn new things always. So don't rely on all things every day. Each and every day your technology and everything is updated, so try to engage with always develop the sorry continuous developing. Then if you adapted to the GLP, good laboratory practice system, it will reliable and reproducible lab results, enhance patient safety and care, improve credibility and reputation. So you can head up and talk, yes, we are issuing a good quality laboratory results, and always patients and clinicians trust you. And you can preparedness very well for the audits and accreditation. So this is a good reference book I recommended highly, because in these laboratory quality standards and the implementation, it's described very clearly and short way how you can improve your quality standards in your laboratory. So I recommend this book to read, especially in 3.2 section, like parts related with this QC and things. So that is the end of my presentation. uh, if you have any questions, you can raise now, or I prepared some questions for you. If you like, you can go through with that questions. Which one is more preferable, your questions or my questions?
Your questions.
Sorry.
Your questions is better.
Okay, actually it's not a I don't know whether these are relevant to you or not, but if you can think question like this: how do you investigate a complaint received from a clinical ward regarding the low plasma glucose values reported for a few days? So most of you are in class 1, I think. So that means almost all of you are in senior MLTs and more than that positions in your laboratory. So always you are receiving this kind of problems in different wards. and people, there are complaints. This is one kind of complaint. uh, can anyone suggest the way of solving this problem? How you start the investigating? Right, with the time I will continue. uh, so before starting this question, you should consider the word how, and how you are going to investigate a complaint. So that means you already receive a complaint and it's a type of low plasma glucose value. So the first thing, you have to document your complaint, right? And verify the laboratory reports and check whether this is a yes or no. So that means you can go back to your records and check whether these test results are low or not. Then if you already have the remaining samples in your laboratory, assess the samples collection and handling. So some laboratories are there, they are keeping analyzed sample for a few days. Then you can go through those samples and check whether the collection is appropriate, the transportation handling is appropriate, or are there any errors, right? Then the other, if it is okay, then you can go with your instrument calibration and quality control. So please check your IQC and EQA records, and that mentioning period, that means that the clinic what people saying that few days. So if you can catch those few days and check whether your IQC is okay, whether it is a like 4-1s rule violation or something, so then you can have an idea where the error is. Then review and calibration, maintenance records, QC results likewise. Then evaluate your analytical method performance. That means confirm that the reagents were not expired. Uh, if you able to do the rerunning, you can rerun the samples. And if you able to do that, it's better to compare the samples with another analyzer or another method if it is available only. So that means you can try to evaluate your analytical procedure. ඔයා කරපු විදිය හරිද කියලා බලන්න පුළුවන්. Then the other thing is review the staff performance. That means on that day, who is the performing person, right? Evaluate of for any human errors such as incorrect pipetting, dilution mistakes, transcription errors are the most important errors we have to check. So you can review the staff performance on that day. And the special thing, please communicate with the relevant ward and explain the situation. So that means not don't tell everything and everything for the ward people, but you have to communicate with them whether you are taking actions or whatever the future things that you are going to do, and take corrective action and preventive actions. And the other thing is documentation. So you have to document everything, what is the problem, what action you take, and what necessary in future, right? So that is a one type of question received from complaints. And this is the another one. Most of the errors in a medical laboratory testing occurs in pre-analytical phase. As a MLT, discuss the actions you can take to avoid errors in the pre-analytical phase. So if you are organizing an answer for this kind of question, first you need to identify the errors. So what are the errors that can take place during the pre-analytical phase? So I think in this present in this time, there are many people with biochemistry, microbiology, histopathology, and many disciplines. So you can think based on your laboratory and think what type of errors that can take place. Then state how to reduce those errors, or what are the solutions that you can give for the problems. So in this answer, I construct based on the biochemistry. Uh, so these are the errors that can take place and you have to mention these errors with examples. The first thing is selection of the test. So that means when you are selecting a test, so most of the time now we are almost all laboratories issuing a request forms. That means the medical officers or the nurses, they have to mark the test required. But if you are marked it wrongly, what will happen? Then preparation of patients, whether you need fasting samples or non-fasting samples, likewise. Then identification of patient. This is a common problem. BHT, wards, those things. Identification of patient. Then procedure of venipuncture. That means whether it is arterial blood or venous blood or the type of tube, preservative and volume, those things are happy. And the procedure of venipuncture means specially regarding total calcium, ionized calcium, and albumin like thing, you need to certain precautions like tourniquet application like things. So you have to consider about those things. Then labeling the tubes, storage before sending to the laboratory, where they keep the sample. If the sample is it's like a electrolyte sample, if they put it into the fridge, the following day you will receive the high potassium value because of the potassium leaking. Some CSF samples you can't keep it in the refrigerator because certain temperature sensitive organisms may die. So the transportation conditions, time, likewise, and reception in the laboratory. So if you are accepting and rejecting samples, there should be a regular way. And storage in the laboratory. After receiving, where you store the samples. After separating the serums, how you store your samples. Then processing of sample. That means the centrifuge speed and time. Sometimes some centrifuges are there. Uh, the speed is unable to control. Sometimes speed is too much high. So it will cause hemolysis like thing. So those are the errors that can happen in your laboratory in pre-analytical phase. So these are the uh, measures or the solutions that you can apply. So you can guidelines on test requesting. So you can give your own prepared request forms, printed materials for patient preparations regarding 24-hour collection like things. You can conduct seminars, workshops, for nurses, porters, sample transporters, and doctors, phlebotomists, how to collect proper samples. Because if you are not receiving a correct sample, you can't issue a correct report. So, establish acceptance rejection criteria on sample reception area, and you can display by using banners like thing. And internal audits, you can consider about the turnaround time of your samples, unlabeled specimen, missing samples, missing request forms. So those things you need to document and recheck which kind of ward, which ICU we are receiving this kind of errors. Then teaching and continuous professional development programs for laboratory staff, and proper maintenance of refrigerators, centrifuge, cool boxes, and displaying their maintenance chart. Then barcoding systems for sample labeling, laboratory information system, it's very much good thing. And use sample belts to quick specimen transportation. So that means the sample receiving is much more easy. So those are the answer for that question. uh, Errors that can arise in pre-analytical phase and how to avoid those errors. Last one is a little bit larger one. I will share this, then you can easily go through. Describe how improper transportation of samples from the wards to the laboratory affects the results of biochemical test. This is highly based on biochemical test results. First, you have to explain the importance of correct transportation. That means if you select the calcium sample, what is the proper transportation condition? And if it is then take then if it is transporting wrong way, what will happen, right? So likewise you have to mention 10 different samples, not always take the blood samples, take urine samples, CSF, seminal fluids, stool samples, other body fluids, then hormone samples. Likewise you can select different samples. So the first things, following are some errors that can happen during transportation. So delaying transportation to the laboratory is a major error, and sample exposed to the direct sunlight or heat is the other one. And improper temperature, especially when if you are sending a seminal fluid samples, you should achieve the body temperatures. Then leaking of samples, improper lids. Then if samples are sent by post, should be protect from heat, moisture, and insects. This is I'm addressing the Guthrie card or the TSH screening card for newborn babies. When you are, it can send through the post. So when you are sending those things, please protect it from heat, moisture, and insects. Then incorrect samples labeling with unfilled request form. So those are the errors that can happen during transportation. So you have to take a few examples like urine samples, lipids, seminal fluid, CSF, hormone assays, blood gas, ionized calcium likewise. You can explain what is the error and how it affect on your results. So that is the end of my presentation. Thank you very much for listening in this difficult time with your heavy workload. So I will try to share my presentation with this group, and please feel free to contact me at any time if you have any questions. And I think you can raise your questions for 1 or 2 minutes if we have time.
Ma'am, can you share presentation in chat group?
Yes, sure. I will. I will do that. It's not a problem to me. I will share my presentation. Don't worry. Give me some time. I will share definitely. Anything else? If you want to send your questions to the chat box.
ලීව් වුණා ඉවරයි. ඉවරයි. මොකද කියන්නේ? කිව්වේ? මේ ටික
Thank you very much, Shamli.
Yes. Dinesh. හරි නේද?
Hello, Chama.
ඔව් මොකදයි?
Hello.
හරි නේද මං?
Thank you so much for sharing your knowledge with us, and it's very detailed and very beautiful lecture.
Thank you very much. I'm always here to share my knowledge with my colleagues. Always, don't hesitate to ask anytime, any help. I will be there. So I will definitely give you this presentation with certain adjustments.